I want to thank everybody for being here, and I particularly want to thank Dr. Podolsky as well as the UT Southwestern Medical School for both hosting this event, but for everything they're doing to help the people in this region as well as the people across the entire state of Texas respond to all different kinds of medical challenges we're dealing with, in particular what we're focused on today, and that is both COVID-19 as well as the flu season that is coming up. Before I get into the flu season, which is one of the topics that we talked about a lot before, I do want to make a couple of points with regard to COVID-19. People in the Dallas-Fort Worth area, one thing that you have observed, if you've been following the numbers, is that the COVID-19 numbers are improving in the sense that so many of the COVID-19 metrics are going in a downward trend. There's a downward trend in the number of people testing positive. There's a downward trend in the number of hospitalizations. There's a downward trend in the active number of cases. And I could go on with some other metrics. The point is this, however, and that is the numbers of COVID-19 are going down from an elevated level. We are not at all anywhere close to being in a safe situation in COVID-19. People need to understand that just because COVID-19 numbers are improving in this region does not mean that COVID-19 has suddenly left the Dallas-Fort Worth area or the state of Texas or the United States of America. It still exists, and it can still transmit at the same rate that it has been able to in the past. What people in the Dallas-Fort Worth area need to know is that the reason why COVID-19 is spreading less today than it was in the middle part of July or the latter part of June is because people in this region have been far more responsible in the way they conduct their daily lives. People have almost uniformly adopted the practice of wearing a mask. It's been reported by doctors in Dallas, doctors in Houston, doctors in Austin, doctors across the entire state of Texas that by everybody wearing a mask, that does lead to a reduction in the spread of COVID-19. In addition to that, people have been more responsible with regard to maintaining safe distancing practices, hand sanitizing, all the right strategies that people learned in March and April. They began to once again be very disciplined about in the latter part of July, and that has led to the downtrend in results. That downtrend has been so incredibly important, especially for places like UT Southwestern as well as this entire hospital district, because there was a time when hospital capacity was getting compromised. That hospital capacity is better now than before, but it will only remain better and must get even better by people continuing the practices of slowing the spread of COVID-19. Everyone must understand this very simple principle. Until we have medications that are capable of treating COVID-19, the only tool that we have to slow its spread is by everybody adopting these practices of wearing masks and maintaining best practices. Along the lines of best practices, I do want to emphasize one very important point. We constantly look for different types of settings and locations that can lead to the spread of COVID-19. Whether it be in Dallas area or the Houston area or the Rio Grande Valley area, one type of gathering keeps surfacing as a spreading event for COVID-19, and that is family gatherings or friends gathering together. There may be this sense that if you're gathering with family, you really are not going to be transmitting COVID-19, and that has been disproven right here in Dallas County. It's been disproven across the entire state of Texas. Or you may think that if you're just with some friends that you typically hang out with, it will not lead to the spread of COVID-19. And again, that has been disproven in Dallas County, as well as other regions across the state of Texas. The fact of the matter is, again, until we do have treatments that are able to treat COVID-19, anybody, anywhere has the ability to both spread and to contract COVID-19 and can lead to an overrunning of hospitals as well as lead to the deaths that have been on a dramatic increase in the state of Texas. Now that said, I want you to know that every single day we go to work to better elevate the response by the state of Texas in responding to both COVID-19 as well as other healthcare challenges that may exist. One of those healthcare challenges that is on the horizon is the coming flu season. And one of the primary goals that we wanted to achieve today was to have the ability to talk to the flu experts at UT Southwestern to learn what some of the best strategies are to make sure that we will be able to address the flu season, understanding this very important point. And that is, with a flu season that could be prolific, if that leads to greater hospitalizations, coupled with the hospitalizations that we're seeing for COVID-19, you can easily see how hospitals in this region as well as across Texas will be completely overrun with an inability for the hospitals to take care of the medical needs of everybody in the entire region. As a result, one of the recommendations that was made moments ago during our roundtable discussion was the importance of getting a flu vaccine early. And the time period for getting a flu vaccine begins as early as in September. And so one of the things we wanted to urge everybody today is to first understand the importance of getting ahead of the curve with regard to the flu during this time of COVID-19. And the best way that you can get ahead of the curve is by going up and making sure that you do get a flu vaccine. Another thing that we talked about was both the importance of testing for COVID-19 as well as the ability to increase the amount of testing that is taking place. Texas is very grateful for the prolific role that UT Southwestern plays in the testing regimen for COVID-19, already testing about 3,000 tests per day. They are working on strategies that will dramatically increase that up to initially perhaps as many as 15,000 tests per day. And then eventually, once all their different tools and strategies come into place over the coming weeks and months, maybe being able to test up to more than 40,000 tests per day. This is remarkable, and it's a byproduct of the excellence that we constantly see from UT Southwestern and what they work to achieve. Another thing that we talked about was PPE supplies. PPE supplies are something that are absolutely crucial in responding to COVID-19, but as you might imagine, COVID-19 coupled with the flu, coupled with the opening of schools this year, those PPE supplies are at an absolute premium. That said, someone who will be speaking here shortly has been the leader in the state of Texas for organizing and distributing those PPE supplies, and that is Chief Nim Kidd, the chief of the Texas Division of Emergency Management. I want to just tell you as an example of what they've been able to achieve, and that is they have already distributed more than 130 million masks, more than 33 million gloves, more than 8 million gowns and coveralls, and more than 4 million face shields. For schools across Texas already, even before schools have begun, they have distributed about 60 million masks and will continue to provide more over the course of the school year, and they've already delivered more than 560,000 gallons of hand sanitizer. So they are stepping up, making sure that the PPE needs of schools, of hospitals, of communities across the entire state of Texas have been and will continue to be met. What I can tell you is this. One thing that we are seeing in the state of Texas is a very robust, very comprehensive response by everybody at the local, state, and federal level, as well as especially with our healthcare community. And I'm very proud to see the role that UT Southwestern is playing in the response to COVID, in response to the flu, as well as all the other things that UT Southwestern delivers every single day. So Dr. Podolsky, thank you for hosting us today. Thank you for all the information that you provided to us. And let me turn the mic over to you.
Well, thank you, Governor. It's certainly an honor to have you here on our campus and to have you joined by the leadership of your administration, who've been at the forefront of the the state response to COVID-19, and now laying the foundations for our ability to address the combined challenge of flu and COVID-19. And thank you for the clear message that you're sending, that our future is really in our own hands to a degree, and rests with our collective willingness to use what we know works, wearing masks, maintaining physical distances, using appropriate hand sanitizers and other measures, because we have seen the downturn that you've noted has occurred across many areas of the state right here in North Texas. And that's especially salient to those of us at UT Southwestern and in other healthcare settings who see the human face of the tragedy of this pandemic when the numbers begin to rise. And we do understand we're facing a challenge of a flu season unlike any other because of the convergence with COVID-19. And I can only emphasize, I can't emphasize too strongly your message of the importance this year of getting that vaccine early, so that we do everything we can to diminish the overall impact of flu and the potential stress it will place on our ability to provide all the care needed by the peoples of North Texas. We at UT Southwestern stand ready to help in any way we can, and for anybody who seeks help from our caregivers. At the same time, as you heard earlier this morning, we are working as hard as we can to identify more effective ways of treating and preventing both COVID-19 and flu. And only can hope that those efforts will eventuate in tools which allow us to go beyond our current dependence on non-pharmacologic interventions alone to really have the means of bringing this pandemic to the eventual close that we all look forward to.